I want to talk to you today about one of my favorite topics, which is collaboration. And as Dave mentioned, the organization that I work with, the La Crosse Medical Health Science Consortium, is a wonderful example of a collaboration. It is actually itself a collaboration, and we live, eat, and breathe collaboration every day. And so to tell you a little bit about how that came together, just so you have some context for why this is so important to me. This is an organization that began with 3 higher ed institutions, a public and private university and a technical college, joining forces with 2 competing medical centers in La Crosse area because they were interested in working on ways to get the students who were the graduates of those institutions to get jobs where they were properly trained in the medical and healthcare professions. And so it was very important for the 2 to be talking to each other. Neither one had the mission of training the other side, but what they did by working together is that they believed they had this notion that they could accomplish more working together than they could working independently. A few years after this collaboration first got started, they decided that what they could really do with this collaboration was to start working on improving the health of our population, not just building a stronger workforce, but actually making people healthier as a group. And so they brought in a couple more partners, and that was the School District of La Crosse and La Crosse County Health Department. So these 7 partners are the core of the consortium, and these are the partners that I work with. And as Dave mentioned, my background is in science. Actually, my master's degree is in animal behavior. It's perfect for this kind of thing. I never thought I'd use it, but I do. So altogether, the 7 partners, plus all the other people that we work with, and I'll tell you a little bit about that, have this mission of fostering collaboration for healthier communities. But collaboration doesn't just have to be used for making a healthier community. That's how we use it. It works for a lot of different things. So why should people collaborate? Why work with somebody else? It's not a natural act. In fact, I heard somebody use the quote, and I love it, that it's an unnatural act performed by unwilling participants. Not so much, really. It's becoming more natural, and the reason is that, for one thing, it's more efficient, usually. Usually it works if you can pick the people from the different organizations, different businesses who can find that this is part of their job, this is part of their expertise, this is something that they're really interested in, bring them together, they will learn more from each other and accomplish more without having to engage the entire organization. And so that's a wonderful tool about collaboration. The workload can be shared by many people. If this person has time this year to be the chair of a coalition, that person might have time for it next year. You can spread that around as you need to. Most importantly, and the reason because it's so efficient, funders are now demanding it. If you're a nonprofit organization and you rely on grant funding, your funders are going to ask you, the very first question will be, who are your partners? Who are you bringing to the table? Who are you working with? Because the days of giving money to one organization to do one thing for one purpose are gone. It all has to be done through collaborations now. And so this is really an important skill for people to have and a wonderful way to get things done. It allows for sustainability. Again, because this is the direction that things are going, this is a very efficient way of doing things, you're engaging organizations that already exist. They already have a budget. They already have a staff. They already have a mission. And so when they get together and become strengthened by the cooperation between them, the work that they're doing is sustainable. You don't have to hire somebody to get something done. They're already in place. They're already working somewhere. And so when everyone is working together, that work will continue even after the funding is gone. And finally, the results of collaborating will be richer because of the many perspectives involved. Just imagine anytime you've done any sort of brainstorming, when you get a bunch of people together, you're going to hear different perspectives. Imagine when you get many organizations together, you get different cultures of different businesses, different organizations, different institutions. Everybody thinks differently and does things differently. You can share practices. So it's a wonderful way to enrich the world that you work in and not work just in your own little world. So some of the things that people should consider when they're talking about whether to do a collaboration or not is, first of all, and this is a very strange question, but it's one that we ask ourselves every time we take on a new project, is collaboration the right solution? Or the opposite of collaboration is competition. Some things are best left to competition. If something is the sole purpose of your organization, if it's your core mission, then Collaboration with another organization might not be the best solution. You might be the perfect ones to get it done. That's your purpose. Maybe everyone can help you do that. Or if there's another organization that does it, let them do it. But when the needs of skills, the needs of talents are spread across many organizations, that's when a collaboration is best performed. So if you looked at the organization that we have, healthcare, who hire graduates, and universities and colleges who produce graduates, they each have a little piece of that mission together of building a better workforce. They have to work together in order to make that happen. This is an easy question, you think, but maybe not. Do you have the right people at the table? Well, obviously, if you're going to collaborate on an effort for community change, if you're going to try to make a difference in your community, you want to have the supporters at the table, the people who say, yeah, that's a great idea. Yes, I can support that. I'll put some money behind that. I'll give you people to work on that. That's easy. Some of the people, though, who get left out of this effort sometimes or get left off of the table are the people who are going to be benefiting from the results of the work. So for instance, in community change, if we're going to take on a project that's going to address drug abuse, we better have some people who have been through that process and are now in recovery. I can't tell you about drug abuse. I've never been abusing drugs before. I've never been addicted to drugs before. I don't know what that process looks like. I'm not the right person, no matter what my training, to tell you what that looks like. I need somebody who's been there. So this is an important group of people to remember, to bring to the table. But an even more overlooked group are the opponents. Now that doesn't sound like something you would normally want to do, is to bring your opponents to the table or bring your competitors to the table. But I'll give you an example. One of the efforts that we've taken on at the consortium is looking at binge drinking in La Crosse. Those of you who've been there before, you know that this is a big part of the culture. But I'm talking about really aggressive, dangerous, deadly drinking. This does happen. Thank you, 2 minutes. One of the things that happens is that people go out, first of all, they get drunk at home, then they go to the bars and drink more, and then they're out in a dangerous situation because now they're downtown. What are they going to do? And they end up on the road, in the river, on a sidewalk, or in somebody's home, and they die. This is a terrible situation. Who would you think would be our opponents? We were told by state level people, we were told by national level people, don't bother to involve the bars. The bars aren't going to help you. That's the first place we went. We called the Tavern League, one of the most powerful lobbies in the state of Wisconsin. They're partnering with us now because they don't want people to die either. There are opponents, it seems, but when you bring them to the table for this issue, they have a common ground. So, some of the lessons we've learned in our work, there's a difference between a need and a demand. People are going to say, yeah, that's really important. You really need to do that, really. But are they going to put their people behind it? Or are they going to put money behind it? There has to be somebody willing to take on the work. We tried to do an effort where we had people in rural communities who were going to be giving services to, and we had to have somebody at each one of those communities to help. But we weren't able to get that because they didn't have the workforce to handle it. So that was an important consideration in passing on that project. Exhaust your resources before you seek outside support. Outside resources are not always necessary. Throw it all on the table, see what you have. And like I said, opponents and competitors can be very valuable allies if you're working on the right topic together. But most importantly, when you're trying to change a community, the change has to come from the community. You can't impose it. It's something that you have to do. And if you don't believe that that can be done with collaboration, I can tell you that all the work that we're doing today, all of the work of our coalition with our 7 partners, is done with a staff of 2. So thank you for listening today.